There it is. Good.
Wow.
Good.
Oh. Like
that. Head goes back for me. Perfect. That's all goes. Excellent.
I really felt that one.
Woo! Want to have a seat. Tell me all about it.
Okay.
Are we good? Mm-hmm. Okay. So she's recording.
Okay.
Tell me what brings you in, because you said you've never been to a chiropractor.
No.
So you're like, I want to try her.
Yes, I want to come see you. My job, which I'm at the desk like at least 6+ hours out of the day, and I'm kind of like a croissant when I'm at my desk. I try to have good posture, but it's not great. So I just have like really bad tightness, especially my left side's worse up here, like in my trap, and then it'll go down my shoulder blade to my shoulder and pull up my neck. Sometimes, depending on how I sleep, it's better or worse. And then it's just been so tight, and sometimes I get a pain like in my mid back that kind of like it'll pull around here. I can feel it.
That's more like a rib. Like
yeah,
when somebody does
no, it
this,
like it starts here, but then like it definitely starts there, because I'll go back like this, and all of a sudden I'm like, oh, and I feel it like kind of pinch, and then it like I feel it come around, like the pain radiates.
There's a lot of like TikToks where they're like grabbing their chest thinking they're having a heart attack, and it's just a pinched nerve.
Yeah, well, yeah, and I think that's probably what it is there, but it's in the same spot, and then every time like I go back like this, at work, it's just like cracking all the time.
Stand here, yep, and face me, like turn to face me. Oh, take a couple steps in place. I'm like, is that really how she is? Yes. And that's the ankle that hurts, the left one.
Yeah.
So look down at your feet. Do you see how this one is turned out a little bit? And it's rolled in.
Oh, no.
It's pronated.
Oh.
So your foot is doing this.
Well,
and as it does this, it goes like that. So the talus is actually pushed forward.
Okay.
And so it because you're more hypermobile.
Mm-hmm.
You have more flexibility in that ankle, and that's why it's spraining.
Oh.
Does that make sense?
Yeah.
So like if you're running, you might want to put like a little brace or some tape, like some kinesio tape, and tape the ankle to provide it some stability. And one more time for me. I know.
Okay. No, this one's fine.
I'm just looking at how you move. Left high shoulder, you really lean into that right side, and then come back, and that right side goes out. And the right, no low back pain though?
Sometimes I have low back pain. Sometimes I feel like it depends on, again, how I sleep. I notice it more really when I'm at work, like my posture, like that's mainly when I notice the low back. But other than that, it doesn't bother me too much.
Okay. No, I think she's got it right, Alice. Yep, right, Alice. So everything else is 80%, just the foot. We'll see. I haven't checked the pelvis completely yet. That looked, though, it looked. What that means is, all that tells me is how I'm going to adjust you.
Okay.
Okay, I don't want to adjust away from the subluxation. You want to push into it.
Okay.
You don't want to make something worse.
Yeah.
So.
No, please make me better.
No. We just get a baseline. I use this as my diagnostic tool, okay? Just this. And my eyes, I suppose, my eyeballs. Is that real tender? I know you just said you worked out.
No, it's
You're
not.
okay?
Yeah, that's
okay.
fine. I'll let you know.
Can you kind of tell how maybe this is more tender?
Yeah, that up there is way more tender.
Than over here, but here's your left.
Oh, yeah.
See, I'm pushing.
Yeah, this one's way more like
Do you see
automatically.
That? Okay,
yeah.
So that's that shift in the atlas. When I say a right atlas, what the heck does it mean?
Mm-hmm.
We call it, it's gone out. No, it hasn't really gone out. It's just shifted to the right and rotated posteriorly. So it's turned like that. Look at that, though. There is a little bit over here.
Yeah, I feel that.
You know? There's the left.
Mm-hmm. The left is like really tender.
Interesting. It's like a block on the right and a fine point on the left.
Weird.
Wow. I know, it's all up in the scalp here.
Mm.
You'll see me like sometimes get out the comb.
Mm-hmm.
And that's what I'm combing out this. Because it's in the hair. You know.
Yeah, I know now.
It's almost done. I'm pretty aggressive. I don't waste time. Yeah, this is good. Okay, that's pretty good. We just have the one up here.
Okay.
But it's we're going to have to address that later because I can't quite get to it in this position. Here's all her locked side here. Like this is just, there. Is this too much? Okay.
No, it's fine.
Oh, this is sore. Okay.
No. It's not. It's fine. I feel it more in my neck. That didn't feel much down the further you went. I will let you know.
Okay.
You'll see it on my face.
Well, I'm not really looking at you, so
Oh.
I can't tell. I'm once in a while I look down, but talk about posture. That's why I'm on the floor. Feels better down here.
Wow.
Is that okay? I'm gonna pull.
Yeah.
Breathe. Excellent. Hold. One more. I think we got it. Perfect. Okay, you ready? Here's the adjustment.
Okay.
We're gonna get the bad one first, all right?
Okay.
Chin back. Oh, that's it.
I felt good.
Yeah, it feels nice.
Yeah.
Do the other side. Just let that rest. That was, I mean, we did it, but it was a little rough. Okay, here we go. Chin back.
Oh, that one.
Right.
Wow.
Yeah, the left side isn't as stuck. Remember, we were talking like right side like a block.
Yeah.
So I had to get the right, but the left. Ooh, nice.
Better?
Well, here, you tell me. Here we go.
Wow. Yeah.
All right.
That is a lot better.
Wee! Feels good to have that spun around. All right, just lay there. Whew. The distal joint just kind of like ate up at the very end. That was cute. Good.
Oh, that felt so good. Wow.
Okay. Be very careful on this ankle. I'm just going to set it.
Okay.
There. That's all I'm going to do to that one. Oh, this one is stuck.
Really?
Yes. Yeah, look, I can't. Okay, it's coming loose. There it is. Perfect. Excellent. Excellent, good. I'm gonna pull on the leg again, okay? It's just help. Bring down that hip. Perfect. Yeah.
Felt that.
Perfect. All right. I'm gonna feel though. I see this curve right here.
Yeah, that left has been so bad lately.
I see it. You know, it's not just you. Like I mean, I can tell. Look at that. Oh. Yeah, it's all the way down. And it stops here. It's tight, but you still have a curve.
Mm-hmm.
That's good. We want a curve in the low back. Okay, so what I'm gonna do is I'm just gonna adjust here, okay? The only thing is, do you mind if I just take this out?
Yeah, go ahead. Oh my gosh.
Oh, don't worry about it. Don't worry about it. Pelvis is still 80%, so I wonder why that happened. You know? Because see, this is posterior, this is anterior, this shifts to the front, this still is high, this ride's high here. See how this is like harder for me to push down, and then this kind of like easily rides.
Mm-hmm.
So we call this an anterior, this is the anterior, or you're in the medical profession, right?
Yes.
This is, so you know, this is anterior, this is posterior.
Right.
In theory, okay, now, technically everything in the pelvis goes posterior no matter what.
Mm-hmm.
But so relative to this side is anterior. Does that kind of make sense?
It does make sense.
I'm gonna check. Okay, now I know why. Okay. All right, you ready for the adjustment?
Yes.
There we go. This is the mid back. It does feel like I'm squishing the air out of you a little bit, okay?
Okay.
Okay. Take a deep breath in. Oh, yeah. Let all the air out. Okay, it's like that. We're gonna do it this way. Deep breath in. And perfect, perfect. Excellent. This one here, you have a little bit of, it's gonna be harder to get B's
Okay.
because of the way it curves. Okay, take a deep breath in again. Oh. Can't quite get these because of the way that they're facing. Ooh. Oh, there we go. A little bit. There's a section right here that I can't get because of the way that they're turned. But as we reduce this curve, this will start to pop up and I'll be able to get them. Okay, and that happens over time. Anyway, what did that feel like? Not too bad?
No, it's fine.
Yeah, it's, people always are like, oh my god, she's breaking them in half. I'm like, it's knuckles.
No,
it's just
not at all.
knuckles. If anything, you know, the comment like, that doesn't do anything, that makes more sense to me than anything else, you know? Because it's so non-invasive, you know.
Mm-hmm.
Oh, she's got, I don't really think she has too much down here. No, I don't think she has any adhesions. A little bit. Tiny, tiny bit. You can just stay there. You're just gonna lay there. I'm just warning you. If at any point anything, and I pull out the mallet here, but if anything is too much, you just let me know, okay? Is that okay?
Yeah, it's fine.
Do you ever get massages or anything?
Sometimes, yes.
Okay, okay, okay. Right there, it starts to get really rough. Whew. Just breathe. Don't pass out on me. See, this is probably where it's pinching.
Mm-hmm. Yeah, it's when
Yeah.
it pinches, it's right there.
Yeah. I didn't even have to. I was like, it's right there. No. Oh my goodness.
Is that me?
Like that was the roller.
Okay.
Once in a while, it's you. You can't feel it, or you?
I felt that one.
Yeah, I was like, wow. There's more in there, you know. I mean, I hit it pretty hard, and I was like, geez, I cracked it, or I crunched it, whatever you want to say, but it's still letting go. It's just, people don't realize how many facets are on the rib attachments. There's so much crunch in this section. There's so many synovial joints. Okay, okay. I'll leave you alone.
Right.
If it's too much, you let me know.
Okay.
Like if it feels better, there's going down the ribs like this. And then there's also going up the ribs. Breathe. Here's the elbow. Is that okay?
Mhm.
I mean, that's about as hard as I'm gonna go.
Okay.
Deep breath in again. One more. Oh, there we go. Okay.
Wow.
All breathe. This is the harder side, okay?
Okay.
I'm gonna work with you one at a time here. And again. This is where I feel it is, like right there.
Okay, yeah. That
Yeah.
I feel
Yeah, this.
is okay. Yeah.
Yes, so I'm just gonna go count back from 5 and then come off. And I don't have to do it again if you don't want. If it's too much, I just don't have to do it.
Okay, that's fine.
But here we go. I'm gonna count back from 5. 5, 4, 3, 2, 1. Like today in Taekwondo, he was like making us hold it. He was counting. He's like, "How do you spell 1?" And like he was doing it in Korean. And we're like sitting there going like, "No!" He's counting backwards and we're holding it split, you know. Here we go. There's a 1 below it, okay?
Okay.
5, 4, 3, 2, 1. Done.
Okay, yeah, I really felt.
That's the one. Okay, that's the one
Ooh.
pinching you. Ah, there she is. Breathe. I'm going to go into the ribs. Out. And get in between there. That's your rib right there. Oh, you can see it clear as day.
Yeah?
Yeah. Oh, there's 2 of them. Okay. Twins! Okay. Nah. Okay. My camera girlfriend.
Other than it being a little red, that's all, but it's expected doing what you're doing, so.
Well, if you take any kind of instrument and you glide it, you're gonna break capillaries. But the body heals. It recovers.
Like I said, what, 7 days, something like that?
4 to 7. If she uses an astringent like what is it called? Arnica, it's faster. It's like 2 days.
Okay.
You're just bringing it out from the muscle to the skin, letting the skin deal with it instead of like leaving it in there after the massage.
You
You
get
know,
trapped in the muscle.
yeah, you're bringing it. When they do panels on this, it's all like inflammatory markers and myoglobin. So it's not red blood cells; it's myoglobin from the muscle.
Okay.
Yeah, it's like, okay. What does this do? Increases range of motion. Decreases inflammation. Oh, you're really, really red over here, though. I gotta stop. Some cobalamin. Let me think about this one for a second.
What?
It's in there, but I can't get to it that easily. I feel it, okay? I feel it here.
Oh, yeah.
Okay, it's there. I don't have to push too hard even, it looks like.
Yeah, I can. Oh.
Yeah, look at that. And I'm like, but I have to persuade this one nicely.
Okay.
Okay, let me
Yeah.
try to be nice. You are going to be
Nicely
sore.
do it.
You know, you're sore, you said, from your arms. But I do feel...
No, yeah, I can tell the difference. Though. I feel
yeah,
that right there.
Yeah, there's just inflammation. Okay. Whew. I think that's... You're not going to like me tomorrow if I go more than that. There's still another level in here.
Okay.
I'm just not... I pulled part of it out. Not all of it. Let's put it that way.
Okay.
So as you clean this out, it stops. You stop bruising even. Took me a while to teach the algorithm what this was. Let's put it that way. I'm just gonna run this down. Is that okay?
Mm-hmm.
The neck is done. Wasn't too bad.
Mm.
Okay. Do you have headaches? I mean,
Actually, I had a headache all last week. Now that you say that.
this is headache territory.
Yeah.
You know, we call it a cervicogenic headache, meaning its genesis is from the neck. Oh yeah, it's coming through. It's free. It's good. See, look.
Yeah, I can actually
All right.
feel the difference.
Okay,
Wow.
doing good. I wouldn't. Sometimes when something doesn't change, then I change my approach. I'm just trying to push that back down. This got lifted, so you looked down, or maybe you slept funny. This got lifted up. So I'm just kind of pushing it back down here. And how does that lift? From looking down. This side, you look down, like
Maybe
you
it
held
was-
a long.
Maybe I was sleeping.
Yeah, it's just like maybe your chin got tucked to your chest. Who knows what we do when we sleep? There it is. Good,
Wow.
good. You're fine.
So different.
All right, you can relax. We're gonna go ahead and get you up and you can put your shirt back on. Here's a mirror.
That feels so different.
Okay, so now what we're gonna do is the rest of the pops.
Thank you.
How do you feeling okay?
I feel, a huge difference.
Okay.
Like, already huge difference.
Okay, and we did just enough then. Because I was a
I've
little
been
worried that.
so tight like the past couple weeks, and so it just feels so much better.
Okay, good.
So much better.
All right, you might be a little sore tomorrow,
No, it's okay.
but it'll go away. Okay, nothing is permanent in here. That's why I have a job. All right.
Yeah, it's permanent.
We can rearrange your spine, but even that will slowly, if you don't put in the work, it will slowly go back. Yeah, it's like anything else. All right, hands on your hips for me. Sit up as straight as you can. Good, and then elbow back, in towards my elbow.
Okay. Like
that. And then elbow. Now we actually adjust the elbow. Wrists are super loose. That's all I'm gonna do. So are your fingers. Yeah, I see that.
Well,
So
I know wrist.
you don't need me to do that for you. Think
Okay.
thoughts right here on my elbow.
Okay.
That's all it goes. It's in. Like, look. Woo! That's some loose wrists. Are you okay?
Yeah. Honestly, is that probably why my wrists hurt? Like, I can't put a lot of pressure. Like, when I do, like, I just started yoga and, like, it hurts. Like, I can't stay in certain positions for too long because I feel, like, so much.
So, yeah, just put a little tape around it. Put a little tape on the ankle, put some tape around the yes.
Tape up everything.
Just stabilize it. Get
Okay.
some kinesio tape. You don't want to, like, block the motion. Kinesio
Right.
tape will at least let you move with the
Okay.
tape. Here we go. Take a deep breath in. Let it all out. Look back towards Linnea. Look back. There it is.
Oh,
Perfect. Other side. My hand's going to go here and here.
okay.
Head goes back for me. Perfect. That's all it goes. Excellent.
I really felt that one.
Woo! On your back. Okay, I'm gonna there's a third joint of the pelvis. It's in the front.
Okay.
Bend both of your knees. In. I'm so dramatic, I know. But I really do have to like concentrate. Press out against my arms. 5. Yep, harder. 5, 4, 3. Good. And then you're gonna squeeze my hands. More. Oh.
They never pop. I've tried. I want them to pop because in all the videos I've watched of yours, like I
Oh, you
always want
know?
that. Yeah,
Yeah.
but like I don't know if mine will do it.
Mine doesn't either. They try it. Mine's from having like 4 kids, I think. Like my pelvis. These are hypermobile, and this one's stuck. That's me, though.
I don't know what's.
Yours might be the same way. You move really easily in your pelvis. Squeeze again. I don't think there's anything there, though. You know what I mean? I don't
Yeah.
feel any resistance.
No, and I don't feel.
I don't feel, feels good. And squeeze. More. No. It's like, it's separating, but it's not going to give me a pop unless it's stuck.
Okay.
And I don't think it is.
Well, that's good.
Whereas mine's freaking stuck. Okay. You okay? Feeling
Yeah.
all right? All right.
Okay, where am I?
Yep. Ears. You want to try that?
Sure, yeah.
Only because it'll be interesting because you have so much inflammation here.
Mhm.
I'm wondering if it's up into the ear. Away from me? Oh, that's the ear. Okay. That's it. That's all. Okay.
Oh.
Interesting. I told you though, it's on the bottom. Okay, a lot of people crack up here, but I don't think yours is. No, see, it's not there. It's all here.
Wow.
Okay. All right.
Felt different.
Okay, so here's
Oh my gosh. Okay.
that.
Yeah, the left side. Way worse. So you had to do a lot more work on the left, right? Well, it felt like it.
I thought it was about even. You know, about the amount of work. Okay, now here's the back. I don't know if I can get it all. Okay. There's the rib.
Oh my gosh.
Oh my god. I was like, no, we have to film this.
Total his reaction. You lied.
I was like, you believe this guy?
Oh my god. Oh wow. Wait, can you go back to the ribs?
That's the rib there.
Wow.
Oh, here. I'm looking at it like I'm looking at it.
Wow.
You go ahead. Yeah, there you go.
Well, like she said, it doesn't last long.
Well, no, I mean, no, it's just crazy.
No. Just know that when you walk around with that, people
Yeah.
are like, what happened to
Yeah,
you?
I was thinking about going to the pool tomorrow, so if I get looked at.
There's more people are just tell them it's gua sha and they know what it is. Just hopefully.
Yeah, I was gonna say, I didn't know what that was. So.
Bend your knees. Does this hurt too much to lean back?
No.
You sure?
Yeah.
Okay.
Correct.
Good.
Do I just go all the way back?
You can. I'm like pushing you. And you're like,
I'm like- Yeah, I'll go a little bit.
It's like an already correct.
You cracked. Yes, I told you
Yeah,
there's a
I felt
region
it.
that I couldn't get.
Everything feels. If I were to do this like before the adjustment,
Oh, yeah,
it
no.
would be awful. Cause
Oh,
I'll like
no.
lay on the roller sometimes, and
Oh.
especially when I had that like down that shoulder blade,
Mhm.
and I was in so much pain, like I couldn't
do it. Well,
for
that's
that
why
long.
we do kind of do a disclaimer saying, you know, you really do need to get checked out by a chiropractor before you do any of this.
Yeah.
Some sort of manual therapist. Hopefully, in this country, in order to manipulate a bone, you have to be a doctor of some sort. So a massage therapist can't do it for you.
Mm-hmm.
You have to go to a physical therapist, a DO, chiropractor.
I can like feel it around here, like in my ribs. I don't know.
Yeah.
It kind of feels like it's open.
Yeah, it's because we're undoing what you do all day.
Mm-hmm.
Because the body does, like
I
this
feel like
shirt.
a new woman right now. This is great.
All right, that's what I want to hear.
I learned so much.
The tricky part, how do you get off? When the head goes back, you're gonna roll into it almost.
Like.
Why? You're gonna roll to your side.
Oh, okay.
But people always like, if you arch more, you actually come off of it.
And do more damage if
No,
or not?
no. When you do a sit-up, you do.
That's what I'm saying.
That's
You got-
right. That's
like the
what-
normal people think getting up that way.
Right. Yeah.